France is just hours away from a nationwide lockdown. President Emmanuel Macron says the country is facing a public health war and that it will take an all-out mobilization to slow the spread of coronavirus. COVID-19 has killed 148 people in France and infected more than 6,600. All citizens will be required to stay home from midday. The restrictions will stay in place for at least 15 days.
On the front line, the caregivers at Lille University Hospital. When patients arrive with lung problems, they are taken to a special unit. But it's also important to keep the medical staff healthy. The priority is really to protect ourselves. We use protective clothing where we are with the patients. The emergency response center in the city has seen 5 times as many calls as usual. The technology failed to keep up the pace. The computer system broke down.
The computers didn't stop for long because the engineers arrived immediately. Why? Simply because there were so many files that the hard drives ran out of memory. We never imagined that we could get there in such a short time.
In southern Alsace, one of the areas hardest hit by the virus, health authorities have already reached breaking point. There are almost no more intensive care beds. In his address to the nation, Emmanuel Macron announced that a military hospital will be set up in the region and the army deployed to transport the sick to hospitals.
We are at a war. We're in a public health war. We're not fighting against an army or another nation, but the enemy is here, invisible, elusive, an advancing enemy, and that requires general mobilization.
Hours before Macron commanded the French to stay home, people rushed to stock up on supplies. Starting from midday today, the movement of citizens will be tightly restricted. People will be allowed to leave only for essential activities like food shopping. Some 100,000 police will be deployed to enforce the lockdown.
Violation of these rules is currently punishable by a fine of around €38. It will be raised very quickly to a higher level, which could be €135. Our aim is not to punish, but to call everyone to account.
As doctors warn about an increasingly dire situation, many hope the aggressive move by France will save lives.
Our correspondent Lisa Lewis joins us now from Paris. Lisa, France faces a complete lockdown starting midday today. What's the situation in Paris where you are right now? How are people responding to the crisis?
Well, I think many people here were expecting that there were rumors going around that it would even be worse, actually, that we have to stay at home for 45 days, couldn't leave the house at all, and that there would be a complete curfew from 6 p.m. on. Now, what the president announced was a bit of a lighter version of that. However, many people are obviously not really happy about that. There are lots of people, it's reported that many people are actually leaving big cities such as Paris to go to the countryside and stay with someone for this period of 2 weeks. Some people, though, are expecting the president, the government, to maybe announce even stricter measures, thinking that this might be just the first step.
We see here live pictures as you speak, Lisa, of the Champs-Élysées. Still a lot of traffic, maybe people driving into the country or maybe not taking it seriously enough just yet. Yet experts warn of an increasingly dire situation. What does that mean for each and every one?
Well, it means that now from midday on, really, you will not be able to leave the house unless you go grocery shopping. You have to go to work. That is, you can't actually work from home. You have to take care of someone, for example, an elderly parent. And this all works with a declaration of honor that you have to download from the internet. You say, I declare that I have to go to the shops now, and then you will be let through. You can also go for a run, for example, or walk your dog, and unless you go with someone. So the government is really trying to isolate people. I think now people are still trying to do the last thing that they needed to do before going into lockdown. That's why there are many people out in the streets, or many people are also leaving certain places to go to the place of confinement for the next 2 days.
Now, some in France say that we could soon see a scenario like in Italy, where doctors have to choose who to treat, a decision between life and death. How fast is the outbreak progressing in France?
It's progressing faster and faster. We're not at the Italian scenario just yet, but the number of contaminated people over the past 24 hours was at 1,200 compared to 800 the day before. So it's progressing faster, and that's also what the government wants to make clear to people, that if they want to prevent that Italian scenario from happening, that they have to stay at home. The president last night in his speech said several times, we are at war. He was appealing to the civil responsibility of each French person, each people living in the country, because obviously he had the impression that people weren't taking this seriously enough, especially as many people on Sunday afternoon, it was really nice and sunny here, were out in the streets, spending time with their friends close together, not respecting the minimum distance. And he really wanted to make clear that the French now have to change behavior if they want to prevent the Italian scenario from happening.
All right, Lisa Lewis, they're reporting from Paris. Thank you so much. Well, here in Germany, the government is also ratcheting up its response to the coronavirus outbreak. More than 7,000 Germans have been diagnosed with COVID-19. 17 have died. Chancellor Angela Merkel addressed the nation on Monday. Her message: no more travel, stay at home, keep your distance.
The chairs had been especially arranged to keep people well apart. But that wasn't the only thing out of the ordinary at this press conference. After high-level talks at the Chancellery, Merkel stepped out to announce the most drastic response to a health crisis in living memory. Retailers of essential supplies, such as pharmacies, will remain open. Supermarkets will even be open for an extra day on Sundays. But from playgrounds to hotels, leisure activities have been severely curtailed.
Hotel accommodation can only be rented for and non-tourist purposes. That also means that there will be no holiday travel within Germany and abroad.
Bundestag President Wolfgang Schäuble met with party leaders to discuss how to keep parliamentary business running during the pandemic. Later in the day, Merkel held a telephone conference with state ministers over the new measures. Restrictions such as the closure of playgrounds are to be implemented uniformly across the entire country. In Germany, hospitals are well stocked, and the government is keen to allay fears over the fallout from the disease.
We are setting aside 10 billion euros to meet the costs arising from additional medical expenditure and the economic consequences of the virus. We are leaving no one behind.
A crisis committee set up by the Health and the Interior Ministries is meeting on Tuesday to help put in place the raft of restrictions. The question now is if the measures will succeed in slowing the spread of the coronavirus.
And for more on the situation here, let's bring in our political correspondent, Hans Brandt. Hans, new measures are practically announced on a daily basis now, but no complete lockdown as in Italy or France just yet. Why is Germany taking a less drastic approach than some of its neighbours?
I think there are two reasons for this. One is a formal reason. The fact is that the central government in Germany has not yet declared a state of emergency. In other words, it has not yet got the powers formally to impose such a lockdown. The other reason is I think that that final coercion is the final instrument that the government still wants to keep as a possible next step, while at the same time trying to in some sense, still force people not to go out, simply by making the reasons to go out all the more difficult, to reduce the number of reasons why people would like to go out. There's no reason anymore to go to the cinema because it's closed, to go to the theatre because it's closed, to go to your gym because it's closed. So people have no reason to leave their homes, and at the same time, this form of how shall I call it, maybe lockdown by persuasion is still an attempt to appeal to people's reasoning, to tell people, look, we are not going to force you to do this, but please, now, under these circumstances, you really must understand that it's necessary.
Especially as the number of cases keeps rising. How are Germany's hospitals and the health system as a whole coping right now?
At the moment, Germany has not yet reached the position where the number of serious cases that need hospitalization, that need intensive care, that need respiratory help, that number of cases is not so large yet that the German hospital system is under strain. The final wave that could overwhelm the hospitals has not yet arrived there, and that, in fact, is the reason for these new measures, and in fact the reason for all the measures that have been taken in recent weeks. It's to try and avoid that from happening, to try and prevent the large number of cases in fact coming into existence for such a large number of people to be infected so seriously that the hospital system breaks down. The hope is that the number of infections, the number of new infections will be reduced enough so that the hospital system in the end can cope with those people that need that critical care.
All right, our political correspondent Hans Brandt, thank you so much. British Prime Minister Boris Johnson has urged all citizens to refrain from non-essential contact with one another to help slow the spread of coronavirus. He called on Britons to avoid all social venues as the country faces what he referred to as the fastest growth period of the virus so far. His government is still facing criticism for not ordering school closures. But Johnson said that social distancing measures will help to ensure the virus is a short-term problem.
Now is the time for everyone to stop non-essential contact with others and to stop all unnecessary travel. We need people to start working from home where they possibly can, and you should avoid pubs, clubs, theatres and other such social venues. We are asking people to do something that is difficult and disruptive of their lives, and the right moment, as we've always said, is to do it when it is most effective, when we think it can make the biggest difference to slowing the spread of the disease, reducing the number of victims, reducing the number of fatalities.
Well, our correspondent Birgit Maas joins us now from London. Birgit, Britain took its time to take measures. Why is the British government still only advising citizens to reduce their contacts instead of imposing mandatory measures?
Well, Boris Johnson put it this way. He said Britain is a mature and liberal democracy and he is trusting people to adhere to the government's advice. He also stressed, though, because of course he was questioned about that and whether more draconian measures and a bit more pressure might be needed. He said, we have the powers, we have the legislative, we have the emergency powers, so should need be, we can be more strict. But for the moment, Britain is not even closing down schools. So we can see, I think, that the situation is also going to accelerate. The British government had been under a lot of pressure over the weekend because even last week they were fairly lax and they said they're still monitoring the situation, but they're not really going as to closing down or advising people to stay in. So this has changed as of yesterday. And I can imagine that if they see maybe like in France, like Lisa Lewis has explained earlier, that the people are not adhering to it, that then they might change and might be more strict and actually really force people to stay indoors.
And would people then stay indoors? How is the British public responding to the crisis right now?
It seems that it's basically twofold. I know of some people who who are really worried, who have left London. London is ahead of the curve, as the government explained yesterday, in terms of cases. So people were worried with underlying health conditions that they couldn't be really helped here in London, and they even left the country to other countries where they thought they might be helped better. But then again, I also am seeing people still out and about, a lot of young people. I saw yesterday's not that much happening in the cafes and the bars as usual, but young people still out and about. I think they are taking it less seriously. They think they're just not as much in danger as others. But we will see. I mean, people have seen other European countries. They have seen the examples. So I think people are braced for tougher measures to come.
Well, Birgit, I mean, all of this happens for Britain at a time where Brexit is still underway and, of course, where the National Health Service is also under strain. How is the health sector dealing with this?
Well, this is the biggest worry, that Britain, for example, has less hospital beds per capita than, for example, Germany or France. So the fear is that, as in other European countries, that the health service could be completely overwhelmed by severe cases. And the government has asked, for example, other industries, not health industries, to work together and to manufacture more respiratory equipment, because this is what's expected will be in shortage. So we are not there yet at the moment. It doesn't seem to be overwhelmed as yet, so we haven't had that. But doctors, we know, and people who work in hospitals, they're definitely worried that they might be in the future.
All right, Birgit Master reporting in London. Thank you. And here's a look at some more of the latest coronavirus developments. Hong Kong will quarantine all new arrivals for 14 days to preserve its current success at limiting the outbreak. South Korea will also tighten border checks after 3 days of reporting less than 100 new infections. The Philippines has suspended trade on its local stock exchange, becoming the first country to close its financial market over coronavirus fears. And Wuhan, the Chinese city where the virus was first detected, reported just one new locally transmitted case on Tuesday. Now, there were another 20 cases recorded in other parts of China, but they were all brought in from people travelling back from overseas. The city of Wuhan has announced all overseas returnees must now quarantine for 14 days. The first batch of medical workers began leaving from Wuhan on Tuesday morning. They have been supporting temporary and designated hospitals in the city of Wuhan for over a month. More than 42,000 medical workers from across China were dispatched to the area since the virus outbreak. Their departure comes as Chinese authorities begin to claim victory over the deadly virus.
China has fought the coronavirus with unified strength, and the crisis will soon be over. At least that's according to the daily stream of news from China's state television. Drastic measures undertaken by the Chinese government at the beginning of the crisis have in fact led to a drop in new infections. Thousands of patients have recovered. Many factories throughout the country have started up production again.
At the moment, we are at 70% of our capacity, but that figure will increase day by day.
The World Health Organization has praised China's response.
Praise China again and again, because its actions actually helped in reducing the spread of coronavirus to other countries.
The construction of an emergency hospital in Wuhan in just 10 days impressed the world. The hospital was closed on the 8th of March with all patients fully recovered, a fact that was proudly announced on Chinese state television. What media doesn't report is that Chinese President Xi Jinping has gone on record as saying he already knew about the virus outbreak by January the 7th. The public was only informed 2 weeks later. Chinese doctor Li Wenliang had already discovered the virus and warned of the dangers posed by it in December last year. He received a warning from police and was forced to write an official apology. He later became infected and died in early February. Other attempts by journalists and doctors to draw attention to the gravity of the situation and the initial incapacity of hospitals to deal with the crisis were brutally repressed. The whereabouts of several whistleblowers is still unknown. China has had success in battling the epidemic, but with 13,000 people still infected, the battle is far from over.
Now for more, let's bring in now Derek Williams from our science department. Derek, we just heard that Chinese President Xi Jinping knew about the virus 2 weeks before he informed the public. How did this information come about, and did holding it back endanger public health?
Well, you know, hindsight is 20/20. I can't state too often or often enough that we've really entered uncharted territory. So I think trying to point fingers at China's behavior back in January at this particular juncture is pretty pointless. I think what's relevant is going forward now is to look at what China actually got right and why they've garnered this praise from the WHO, and try to maybe implement some of those successful measures in Europe and the US.
Well, certainly going by the data that we just received from China, the country seems to have won a major battle against coronavirus for now. Can the country relax now?
China is far from out of the woods on this. You know, their containment strategy is based on these draconian measures, and they appear to have worked. But there's, of course, a lot of fear about what happens next. You know, when these draconian measures are loosened, will the numbers of infected in the country shoot back up again? Are we going to see a second wave of infections? Will China re-import the virus? There are lots and lots of open questions, and we don't really have a lot of answers as of yet.
Now, of course, the virus came from China. The first cases started there, and we had several months here in Europe to observe. Should other countries, should we here in Europe adopt the same measures as China to beat the virus?
Well, the fears that China has are fears that every country is going to have if these measures do lead to containment, which is it's really far from certain. In Germany, for example, we're not looking at containment, really. The measures that have been implemented, which might actually at some point also lead to lockdown here, are not there to try to contain the virus. They're there to actually flatten this curve. I think that the German government is still going from the assumption that 60 to 70% of the population is going to at some point get it. And so the important aspect of importing those measures and looking at things like lockdowns here in Europe is not about containment, it's about an attempt to slow the progress. So health systems aren't overwhelmed. That's what they're trying to do with these measures, is flatten the curve.
Right, and flattening the curve is also aimed at hopefully eventually having enough time to come up with a vaccine. Where are we with the development of a vaccine right now?
Well, there was a surprise announcement actually yesterday that the first human trials are beginning with a vaccine in the U.S. Now and all of that takes time. It just takes time, and all of the experts, in spite of the fact that they've even gone into human testing in such a rapid manner, everybody is still saying this is going to take at least a year and possibly much longer.
Right. Clinical trials take a lot of time, and then there are different standards when it comes to those trials in the United States or in Europe, where things usually take longer. Do you think, just a hunch, that given the current situation, the emergency, that things could be sped up and a vaccine could be provided sooner?
Well, I think that approvals authorities are going to be much more willing to take risks than they ever have been before. Generally, they're extremely conservative and very cautious when it comes to questions like this, because you can put people in danger with testing of this type of vaccine. But at this point, they're moving forward. The technology that they're moving forward with is not a live virus. It's not a weakened virus that they're injecting into people. What it is actually what's called an RNA vaccine, and that means they're injecting basically the information into people to get them to produce viral proteins themselves, and that will then kick the immune system into action. Or at least that's the hope. So in theory, at least, this isn't a dangerous step to take, and that's why they've taken the unprecedented step of allowing it to go forward so quickly.
All right, Derek Williams there from our science department. Thank you so much. President Donald Trump has also shifted his message on the coronavirus in the US. Trump spoke to Americans on Monday, telling them to stay at home and avoid crowds. Many states have already begun taking action.
This is Los Angeles, where the coronavirus has brought the city's pulsating social life to a grinding halt. It's just one city, with its streets empty, its shops closed and restaurants with drastically reduced customers. On the other side of the country, in normally bustling New York City, there are notably fewer people out and about. It appears Americans have heeded the advice of President Trump, who's been under fire for not acting quickly to stop the spread of the virus.
Therefore, my administration is recommending that all Americans, including the young and healthy, work to engage in schooling from home when possible, avoid gathering in groups of more than 10 people, avoid discretionary travel, and avoid eating and drinking at bars, restaurants, and public food courts.
As the Trump administration introduces stricter rules, testing for the coronavirus is increasing. Drive-through centres like this one in Ohio provide results in 8 to 12 hours. It's just one of many locations across the US with this service. In spite of the increasing measures, doctors are bracing themselves for a prolonged crisis.
Certainly this is not going to be something that lasts days, it's going to last weeks. If I had to guess right now, I would say we're in for at least a 3-month haul to deal with this virus before we really understand it and are able to cope with it in a more reasonable way.
A stark warning to Americans that the emergency is far from over.
Asian markets are seeing a bit of relief on Tuesday, trading mostly in the green after Wall Street had its worst day in more than 3 decades on Monday. Tokyo's Nikkei reversed losses from the day before. Stock exchanges in Hong Kong and Thailand also rose moderately. The rebound in Asia follows news from the White House that it's planning support for the air travel industry. The sector is reeling from the fallout of the coronavirus outbreak. The recent losses in global markets are the worst since the 2008 financial crisis. And meanwhile, the airline industry is working to fix its corona-related problems. Travel restrictions are not just affecting passenger travel, but freight as well. Every time a new country limits flights into and out of the country, that affects the global logistics chain.
This Boeing 777, owned by Lufthansa's freight subsidiary, is set to fly to Shanghai, full of machine parts and medications. All of Lufthansa's cargo aircraft are fully booked, as dispatchers work to reduce the backlog of goods from weeks of canceled flights. In the wake of the coronavirus crisis, it's not just goods that are complicating things.
Normally, we would do a direct flight, for example, from Frankfurt to Shanghai. We're currently operating in a security mode, a caution mode, over Novosibirsk in eastern Siberia. That means a stopover, and that allows us to have a crew change there and avoid spending the night in mainland China.
In the cargo area of Frankfurt Airport, containers and pallets are stacked and ready to ship. Cancelled passenger flights from Lufthansa contributed to the backlog of freight. The German airline grounded thousands of flights across the world due to virus-related travel restrictions. And in the belly of almost every passenger plane was supposed to be cargo. The head of Lufthansa Cargo faces a dilemma. Many of his 4,000 employees aren't working, despite a big backlog of orders.
If you imagine that 50% of our capacity is in the bellies of passenger planes and that they're no longer flying or just to a limited extent, then of course we're short on capacity. And since we lack capacity, we also lack employment. So of course we're thinking of short-time work.
Stephen Haltmeyer is in a similar situation. He's the head of a medium-sized air and sea freight company. He's seen a 10% drop in assignments compared to a normal January or February. Because of the limited transport capacity and high prices, his company has to turn away orders from some customers.
At the moment, planning is almost impossible. We're living day to day, not thinking about tomorrow. We've come to grips with the situation in China, but other markets are coming, like the USA.
Adding to that concern are worries around additional corona outbreaks in Germany. If too many employees fall ill, some branches may have to shut down completely.
Car makers, including Volkswagen and Fiat Chrysler, have scaled back production at their European plants as coronavirus restrictions put the squeeze on production lines. They're also facing questions of demand, with more and more people forced to stay at home, except for strict working needs. Many forecast a heavy fall in car sales in March.
Volkswagen had been looking forward to a bumper year after the Dieselgate disaster, but now it's slashing output at its Lisbon plant because workers aren't turning up. Portugal ordered all schools closed in response to the coronavirus outbreak, leaving many employees struggling to take care of their children. VW says it'll suspend operations in Bratislava after Slovakia declared a state of emergency over the virus. Meanwhile, Italian-American company Fiat Chrysler says it's halting production for 2 weeks at most of its European plants to help protect staff and adjust to a slump in demand. And just days ago, Renault-Nissan, as well as VW's Seat unit, announced temporary stoppages in Spain that could last for days or weeks. And France's PSA had hoped to capitalize on the Car of the Year award for its Peugeot 208 model. But now it's shutting down its European factories until March.
Well done.
The news sounds bleak, and it is. But analysts say Europe's car industry suffers from oversupply, which an industry-wide closure could fix. And people in the market for a car will likely still buy one, even if they have to wait.
And the world of sport has also suffered under the weight of the pandemic, with many countries banning all sporting events in the near future. Germany's Bundesliga clubs have confirmed that football matches will be suspended until early April. Further postponements are expected to be announced after another meeting in 2 weeks' time. The German Football League convened a meeting with all 36 clubs from the country's top 2 divisions. Chief Executive Christian Seifert said the health and financial security of all 56,000 football employees was the highest priority. On Tuesday, Europe's governing body UEFA will meet to discuss the future of the European Championship. And in a blow for organisers of the Tokyo Olympics, the IOC has announced that all qualifying tournaments for boxing have been suspended due to the coronavirus outbreak. The European qualifiers were underway in London over the weekend, but will now be halted after an initial decision to continue without spectators. The IOC aimed to still complete qualifying in either May or June. But the Olympics governing body is holding executive talks on Tuesday to discuss the latest developments.
How should drug companies handle the coronavirus pandemic? Pharmaceutical firms rushing to find a vaccine could potentially make billions of dollars. So, what must be done to ensure they don't put profit before saving lives? This is Inside Story. Hello and welcome to the programme. I'm Mariam Namazi. Scientists around the world are now racing to find a vaccine and a cure for the coronavirus. Governments are pledging millions of dollars of taxpayers' money for research in both public and private firms. The global vaccine market is estimated to be worth nearly $60 billion annually. Pharmaceutical companies have been criticised in the past for being too slow in combating diseases like SARS and Ebola and charging high prices for new drug treatments. The president of the European Commission hopes a vaccine will be available, though, later this year.
In addition, we are accelerating research. Yesterday, I spoke to the managers of an innovative European research company. They work on a promising technology to develop a vaccine against the coronavirus. The European Union provides them up to 80 million euros, and I hope that with this support, we can have a vaccine on the market perhaps before autumn.
So let's bring in our panel. Joining us from here in London, Gustav Ando, Executive Director for the Economics and Country Risk Life Sciences Practice at IHS Markit. From Miami, Gerald Posner, investigative journalist and author of Pharma, Greed, Lies and the Poisoning of America. And also here in London, Andre Spicer, Professor of Organisational Behaviour at Cass Business School at City University of London. Very warm welcome to you all. Thank you for joining us on the programme. So we've been speaking about the impact the coronavirus pandemic is having on businesses, big and small. They're all taking a hit, but there are some businesses and industries that do stand to profit, perhaps none more so than the pharmaceutical industry. Gerald, you have said that pharmaceutical companies now stand to gain a once-in-a-lifetime business opportunity from COVID-19. Why have you said that?
Yeah, it's a cold calculus, Marianne, no question. And there are going to be winners and losers inside the drug industry. The winners are going to be among the 22 to 26 drug companies and biotech firms that are racing right now to try to get a vaccine. There are billions of dollars literally that will be funded from governments, private research, academic centers, and those pharmaceutical companies. The first one that crosses the line, in your lead-in you talked about the possibility of this autumn, but even if it's a year to 18 months, the first one that crosses the line gets the vaccine that governments say that's the one we want. We have to deploy it literally to hundreds of millions of people. They're going to be able to make a profit on that at that point.
Right. So, Gustav, let me ask you then, what are your thoughts on that? How much profit do these companies stand to make? Just how lucrative could a COVID-19 vaccine, medicine, antiretroviral drug be for them?
Well, let's first be very clear that we have no guarantee that that's going to be the case whatsoever, that we even get to having a vaccine or treatment here. There are, I think as most of us know, inherent risks in developing treatment with a very, very high failure rate. And so therefore, we just simply don't know. I mean, we're expecting to see clinical data fairly soon on some of the early activity that we've seen. But in terms of the actual opportunity, it's fairly limited, right? So as has been highlighted here, it'll be maybe 2 or 3 companies at most that might be able to succeed out of this. And for them, you know, if we're talking about vaccines, which is a very specific kind of industry, the margins are typically razor thin, right? It's very hard to scale the production in any meaningful and profitable way, and only a really handful of companies can actually do that and manage it.
Andre, tell me, what have we been seeing in terms of how investors have been reacting in the past few weeks to pharmaceutical companies, particularly those that say they're working on vaccine and drug programs? What are we seeing in the market?
I suppose what we've seen is that these companies are inherently risky, but they tend to have quite high profit margins. So the largest US drug companies have profit margins of 13% versus far lower for many other companies. So they're in many ways a good bet. The other thing to note is that these firms have often spent a lot of their money not doing research and development, but buying their own shares back. So according to one calculation, they've spent, I think, more buying their own shares back from, I think, up to 2017 than they had done on research and development. And some of the firms that are currently racing to develop a vaccine, this is indeed the case for them. So you need to ask this question of whose money is being spent on research and development, partially the companies, but it's often partially public funds. And the question is who has to then pay for it? So it's often the public pays twice.
Gerald, the problem with this is that running a company, a pharmaceutical company, is very expensive. I mean, I appreciate what Andre is saying there about perhaps these companies not spending as much on research and development as certain government-funded agencies, but we know that running these sort of companies is expensive, and without a profit, well, they either shrink, they are either sold to another company, or they simply die.
No question about it. Look, it's a for-profit business. I understand that. The United States is the only country that's crazy enough on the planet to allow drug companies unfettered power in setting their own prices, list prices. Every other country has some form of negotiations. What Professor Spicer said is absolutely critical. In the U.S., for example, the National Institutes of Health, which is a public health agency funded by taxpayer money, has since the 1930s, I talk about this in a chapter called The Coming Pandemic, since the 1930s, they have spent $900 billion on public research, which pharmaceutical companies have then taken and put under patents and made billions of dollars. The first HIV drug treatment, AZT, was actually the result only of work done at the federal level with federal money and government sponsorship. The only thing Burroughs, who had the patent, did was provide the underlying drug, and they couldn't even make it because they weren't producing it. It was a patent they held, and it wasn't even in production. So what happened is they made billions of dollars from the U.S. government research and efforts of academic work. None of that came back to the public for further scientific research. That's the part of this that is
Gerald,
outrageous.
just to get, I mean, so that the research and development side is crucial here. Making a profit is important for research and development. Research and development is crucial for there to be scientific, medical breakthroughs, particularly at a time like this. Now, how much does the industry spend on research and development?
It's a great figure because the industry says that it spends about 20 to 22% on research and development, 4% less than they spend on marketing and promotion in the United States. And Marianne, here's the real question that you need to ask. Gustav talked before about only a couple of winners, and he's right in terms of getting the patent maybe on moving forward with the vaccine. But then there are manufacturing firms. They're all drug companies. The only ones able to do this are drug companies. And what's our experience in the U.S.? It's terrible, because the only time since in modern history since World War II when a U.S. president, Gerald Ford, ordered a national inoculation program for all Americans for the swine flu back in '76, the Ford drug companies chosen by the government to manufacture the product, 100 million doses of the vaccine, they withheld
right,
it.
But I mean, Gerald, look, they say, I mean, I think you had several pharmaceutical bosses testifying before Congress last year. I mean, this is a long-running issue. It comes up again and again. They were asked, why do drugs in the UK cost so much? Because, like you said, there's a big differential with how it works in the US compared to the rest of the world. They are saying, look, it is the cost of research and development. And not only that, they argue that America is shouldering that burden for the rest of the world.
That's true as well. But, you know, the one question I have is, and I'm sure that Gustav and Professor Spicer are following this, those of us who have a microscope on pharma, we in the United States passed a congressional bill the other day with the president, $8.3 billion emergency funding. There was a difference between the first draft and what was passed. What was different? The pharmaceutical lobby got in and took out two clauses. One of them relating to limits on the amount of profit that they could make so the third world and developing nations could be fed eventually with this vaccine. And the other was that if they worked in the program and then dropped out, they want to keep their own intellectual property. The government wanted it to be shared by everybody. They get to keep their intellectual property. You know, if we don't keep our eye on the ball now, everybody's worried about the vaccine and health. They should be. I understand this is a deadly virus. But if we don't watch also at the government level what pharmaceutical companies are doing...
But, Gustav, let me come to you because, I mean, look, you have a profit-driven pharmaceutical... I mean, this is the business model, isn't it? This is the model that exists. We desperately need these companies right now. We've always relied upon vaccines and medicines. You might say that the model is a weakness in the global health system, but it is the system that currently exists. It's a profit-driven model.
It is a profit-driven model, but let's also be clear that the U.S., as has been mentioned here, is really kind of the exception, right? So the U.S., in terms of its healthcare system, is very unique and has a lot of very complex and multifaceted characteristics that you just don't see almost anywhere else. So, you know, over here in Europe, for example, and most other countries around the world, you have a negotiated price. And if the manufacturer and the government cannot agree on a price, the drug is not available. And there are many cases of that happening.
So you're saying there needs to be more regulation, more price controls in the US? Because... Yeah, so you're saying there needs to be more regulation, more price controls in the US. How would that affect the development and distribution of a vaccine for coronavirus?
I don't think it's my place to say what a country should and shouldn't do. There are all sorts of reasons why healthcare systems are built the way that they are, and there are plenty of problems with healthcare systems outside of the U.S. But certainly the model that has been built, let's be very clear, is very successful, and we have successfully converted many deadly diseases into what were previously deadly diseases into chronic illnesses. And for example, hepatitis C is a very good and very recent example of that.
Andre, a different way of looking at this perhaps is that when drugs do get expensive, does it draw more product to market? The more expensive they become, the more profits you see, the more investors that draws in. And it's kind of like any other commodity that it would hopefully lead to more innovation. Isn't that the rationale?
So in many ways, it's kind of a bit of a winner-takes-all market. So you have to take very long-term bets on there's certain diseases. So you make a calculation. This disease is worth solving, which normally means it's a first-world disease where there's either governments or individuals with the money to pay for it. Then you take a bet over a 10, 20-year period. I'm going to develop vaccines around, or products around that. And then most of those don't work out. So that money's gone. But then one or two of those will become big blockbuster drugs, which will then fund everything else. So you have to take a long time horizon. The other thing to note here is that investors are increasingly looking for kind of the ESG, which is environmental, social, and governance returns on it. So they're looking in terms of their portfolio and they're saying, how is this firm performing in a socially responsible way? So if drug companies can show that they're doing socially responsible things, it's likely that people providing capital, which is pension funds, etc., are likely to be more favourable to give that money to those drug companies versus companies who are behaving in an irresponsible way.
Gerald, really, how far does that apply right now? Because I suppose if you break it down in a simple way, no company is going to run clinical trials for something where they don't stand to make any money. So even if the scientists said, OK, let's get together and do this research and do this on our own, let's set up our own company, they still have to get the funding from venture capitalists or whatever. So you can't get funding unless there's a return to be made on the investment.
But here's where the return is, I think, in a way, Marianne, which is interesting for some of the drug companies. And I'm talking every day, by the way, to infectious disease experts who were former pharma executives before they've gone out on their own back to research. If a company gets involved and gets public funding for this, with this flood of money that will be coming from CEPI and from the U.S. government and for others, they get involved in the research. They don't get a product. They don't get far enough along. They don't develop the real vaccine that's used. They still are able to keep the intellectual property from that work that they do with public funding that might help them on development of antivirals, on other matters. I mean, Gilead and Hep C, Gustav was talking about is one of the great success stories, both in terms of profits and in terms of helping people. It's that type of information they need for the rest of their drug line that they may be able to get some help on with antivirals. They get involved in this research and they get it paid for by the government or private institutions. It's a win for them, even if they don't get into the final product.
Right. So, Gustav, I mean, these are public companies. They are really there to serve the shareholder. I mean, what are we saying? That they shouldn't necessarily be public? I know you don't want to make, broad sweeping statements on what governments or what should or shouldn't happen. But when you are looking at something as severe as finding a vaccine or a medicine or some kind of treatment to manage an illness that's created the crisis that we have now, I mean, is this precisely the sort of research that governments should be funding? You can't just leave it to pharmaceuticals.
Well, I don't think that a drastic solution like what you're proposing there is really on the cards or really what anyone would really want out of this, including those who are very, very critical of the pharmaceutical sector, right? There's a reason why we've had so many successes in whether it's oncology or hepatitis C or HIV/AIDS in terms of improving patients' lives and indeed curing illnesses, and to be in a position where we can, with a degree of confidence, say that we're probably going to have a successful vaccine or treatment for COVID-19 probably by this time next year, which would be absolutely unprecedented in the history of healthcare, right? To be able to identify the genome sequence of this disease, which was done in early January, and a year later to effectively have potentially a treatment.
Yeah, but then you have the problem of scaling up, of distribution.
Absolutely.
Is it going to be accessible?
Absolutely.
I mean, I suppose if we look at the timescale, then, because you've said that probably the expectation is that we could see something early next year, and that is the key question: how long it could take to develop a COVID-19 vaccine, and when might it be ready? Gerald, what are your thoughts on that?
Well, Gustav's absolutely right. First of all, a year to 18 months may sound slow to the lay public. It's a speed record in terms of pharmaceutical companies for a vaccine like this. And he also said early on, we are all assuming, and the infectious disease people I speak to daily believe they will get a vaccine on this. But remember, it was just last year, 2019.
So there's a range of companies that are in the race. So you have Sanofi, I think it's a French firm. There's small biotech firms which are in the US, Moderna. You've got Chinese firms. So they're spread across the world. The other thing to note, which is interesting, is that while they're kind of racing each other, there's a lot of networks where there's kind of information sharing going on. So despite the fact that large pharmaceutical firms will kind of protect information and patents they have, they also share a lot of information. So for instance, GSK, big UK firm, had shared some information, which sort of patents and so forth, which would be very useful for developing the vaccine. So pharmaceutical companies aren't just these kind of hoarders of information and profiting off it. Often they'll share information, particularly when you have these kind of big global races.
How important? Yeah, I mean, so let me get your thoughts on that, Gerald. It seems as though we're seeing evidence of information sharing on this. Yes, pharmaceutical companies are in a race. Yes, they want to maximise their profits, but at the same time, the coordination between them will be crucial to expediting some sort of vaccine.
Yeah, what you just said, what Professor Spicer brought up, is absolutely critical. They have to share information on this. CEPI, the international organization that's supposed to coordinate vaccines, backed off that position a little bit, but they're trying to push that now. And we all have to remember that in the one of the greatest modern inventions in pharmaceutical history, penicillin, saved hundreds and millions of lives, stopping infections across the board. That was the result of a crash effort between the British team at Oxford that had really worked it out and the U.S. government that put it on right behind the atomic bomb as a World War II priority, brought in 10 pharmaceutical firms that shared all the information. There was no holding back.
But tell me, Gerald, what's happening now? Because obviously, we have this global pandemic. Are we seeing regulators collaborate with vaccine producers? Is enough action being taken to accelerate the timeline?
Now, unfortunately not. I don't see it. Maybe Gustav, Professor Spicer see it. I don't see it. Remember, the only reason we got it done on penicillin, we were in the middle of the war. There's no better incentive than a hot war. We're in a war now against this microbe, but that's different. People feel scared and they're anxious and they're very nervous, but it's different than the hot war. So World War II was the impetus to do that. We may get here on this pandemic, but we're not here yet.
Tell me, Gustav, how important are partnerships to developing and manufacturing vaccines and medicines for the public-private partnerships?
Oh, it's absolutely critical, right? And one point I want to make here is that there is a reason why it takes sort of 6-7 years, right, to develop a drug successfully, and there's a really important reason for that. It takes that long to understand whether these experimental treatments are safe and effective, right? That what you see in the early testing data is not some quirk in the data, or that if side effects emerge much later on that you wouldn't have captured after a year of testing, right? So there's a reason why we rarely, if ever, sort of approve new treatments with a shortened timeline.
Andre, it's a really good point. Andre, then what are your thoughts on that? Because the challenges for developing a vaccine, and as we've heard, there's no guarantee that there's going to be any silver bullet to this, but you need to think about long-term immunity, protection against mutations. There's so much we don't know about this phenomenon. Is it going to go away? Will it become seasonal? It's many challenges lie ahead.
Okay, so 2 points. One, when you do any big project, whether it's in pharma or infrastructure or whatever, you normally have a kind of what we call a trilemma. So 3 things you have to trade off. One is speed, one is cost, and one is sort of safety or quality. So, and the point is that most of the time you can only have 2 of those 3 things. So the question is really going to be with the COVID vaccine is, what's the trade-off? Which one are you going to be willing to sort of go backwards on? The second point is, the way pharmaceuticals actually do their work and operate, the way they build vaccines has kind of changed quite a lot in the last few years, particularly with the rise of big data. So not just relying on clinical trials for evidence, and increasingly they're relying on patient records. So having access to those patient records to see what the results are is critical about how they're actually developing these techniques.
I want to get a final thought from each of you on the question of if and when we see a vaccine, a medicine, some kind of treatment to manage this illness, is it going to be widely available, accessible and affordable? Gustav, you first.
Well, I think you'll see two phases of it, right? And let's really, fingers crossed, hope that we get to that stage where we actually have a treatment that's proved to be effective, right? So, but the first stage will be focus on the at-risk populations, you know, the front line of the healthcare workers, and clearly older and vulnerable populations, et cetera. That's going to be the first phase. And then wider sort of mass mobilization would happen after that, and you can kind of scale that up separately.
Gerald.
You know, I think, Marian, across the Western world and the rest of the world, Asia and Africa, everybody is suffering from this pandemic, even though it's not infected. Airline industry, cruise industry, travel, businesses, people working out of home, we're all having to make a sacrifice. And what I'm saying is, I think the pharmaceutical industry doesn't have to lose money, but they have to make a bit of a sacrifice as well. They have to share in this epidemic by not only developing antivirals that will adapt and treat this before they have a virus, or have a vaccine. And once they have the vaccine, let them make a profit, but let them have it as small a profit as possible. This isn't the pandemic on which to make a ton of money. And I hope that they follow that and serve the public good on this.
Andre.
So companies have spoken a lot about doing capitalism for the public good. And here's an opportunity to show that in practice, that they can actually use mechanisms of the firm and the financial markets to actually do public good rather than just withdraw value for themselves, their shareholders and their senior executives.
All right, well, thank you very much. Really appreciate the time of our guest today. Gustav Ando, Executive Director of the Economics and Country Risk Life Sciences Practice at IHS Markit from Miami, Gerald Posner, and then also here in London, Andre Spicer, joining us from City University of London. Thank you very much, gentlemen. And thank you as well for watching. You can see the programme again anytime by visiting the website aljazeera.com. And then for further discussion and debate, you can go to the Facebook page. That's facebook.com/AJ Inside Story. And then, of course, there's always Twitter. You can join the conversation there as well. The handle is @AJ Inside Story. From me, Mariam Namazi, and the teams here in London and in Doha. Bye for now.
As the number of recorded coronavirus cases soared past 200,000, the World Health Organization announced the first trial of a vaccine was underway, the start of a long battle.
This virus is presenting us with an unprecedented threat, but it's also an unprecedented opportunity to come together as one against a common enemy, an enemy against humanity.
In the German city of Frankfurt, they've been queuing to get a free test for COVID-19 and they're losing patience.
It's so badly organized. There's a man behind me who waited for 6 hours yesterday when he actually belongs in bed.
In a televised address to the nation, Chancellor Merkel appealed to the public not to underestimate the crisis.
Es ist ernst.
This is serious. Take it seriously. We have not seen a challenge like this in our country since reunification. No, since the Second World War, which depends so much on us acting together and in solidarity with each other.
In some parts of Europe, the health services just can't cope. Because of a surge in cases in eastern France, 6 coronavirus patients had to be flown by military plane from Mulhouse to the south of the country for treatment. Across France, there's a big incentive not to be out in public. If you don't have a certificate allowing you to leave home, the police can fine you up to $150. In Spain, they've already arrested dozens of people for going out since the lockdown started at the weekend. But it's not stopped these housebound Madrid residents from protesting. They're demanding former King Juan Carlos donates millions of dollars he reportedly received from Saudi Arabia to the Spanish health system. In London, it is quieter than usual, but nobody's being told to go home. For some in the British capital, the incremental approach is right.
I think the steps that have been put in place are very wise. It's once again trying to avoid the panic. If the government went into full lockdown and banned things, it's going to be it'd be a lot worse for people's well-being.
But in Parliament, Prime Minister Boris Johnson faced demands to take a more proactive stance.
Why are we waiting so long for mass testing? And why are social distancing measures merely just suggestions?
On Wednesday, Johnson did make one long-expected announcement.
After schools shut their gates from Friday afternoon, they will remain closed for most pupils, for the vast majority of pupils, until further notice.
So, different stages in the outbreak and different responses, but the challenge for the medical world and for societies in general is immeasurable. Nadeem Barber, Al Jazeera.